18%. Just think about that number for a second. What does it even mean? It's not, a grade on a test or some sale at a store. No, for one person, this number, it was a sign that a crisis was exploding inside her body, right down to the cellular level.
Yeah, because for a 14-year-old girl named Amira, 18% was the amount of her body covered in a severe burn. And that single injury kicked off this full-body, life-threatening emergency. So today, we're going to follow her story to really understand the incredible, almost unbelievable cascade of events that a major burn sets in motion. All right, so let's start at the very beginning with the spark, the initial injury itself. We're going to see why a burn like this is so much more than just a skin injury, especially when it happens to a child. So what Amira had is called a partial thickness burn. Now, what does that mean? It means the fire didn't just scorch the surface, the epidermis. It burned right through into the next layer down, the dermis. And that's where all the nerve endings live, which is why these burns are just excruciatingly painful. Now, you might think, okay, 18%, that's serious for anyone, and you're right. But for a kid, it's a whole different ballgame. They have a much higher body surface area compared to their weight, so an injury like this is a massive, system-wide red alert. It literally sounds the alarm in every part of their body. Okay, now we're going to get into the really fascinating and frankly kind of terrifying part, the chain reaction that ignites inside the body. This is the moment where the body's own defense system, its amazing healing response, actually turns on itself and becomes the enemy. So within minutes, literally minutes of the burn, the body just freaks out. It releases this massive flood of inflammatory chemicals. And what these chemicals do is they attack the walls of the capillaries, the tiniest blood vessels we have, making them super weak and leaky. It's like opening up floodgates all over your body. All the good stuff, plasma, protein, all that vital fluid just starts pouring out of the bloodstream and into the tissues. And the result? It's catastrophic. Your blood volume just plummets, and your vital organs start screaming for oxygen they're not getting. That right there is burn shock. And you can see here, this is not just a plumbing problem, right? It's not just about circulation. It is a full-blown, multi-system crisis. The heart starts racing, trying desperately to pump what little blood volume is left. The kidneys are starved for blood, putting them on the brink of just shutting down. Meanwhile, the body's metabolism goes into overdrive, just burning through energy like a furnace. And the immune system, it completely loses its mind, causing massive inflammation everywhere, but at the same time, it leaves the body wide open to infection. It's chaos. So, with all this chaos erupting inside the body, how in the world do doctors and nurses fight back? Well, it is an absolute race against the clock. And luckily, they have a very specific, battle-tested set of tools to do it. And here's the game plan. Job number one, without a doubt, is fluid resuscitation. We're talking about aggressively pumping specialized fluids, like Hartmann's solution, back into the veins to get that blood volume up and stop the whole system from collapsing. Of course, at the same time, you've got to control that unbelievable pain, slap on special antimicrobial dressings to keep infection out, and just watch the patient like a hawk, because the next threat is always right around the corner. And that brings us to a phrase you'll hear in emergency rooms, and trust me, it should send a chill down your spine. Pain out of proportion to the injury. Think about it. When a patient who's already on some serious pain meds starts complaining that the pain in their burned limb is getting worse, that is a massive red flag for a terrifying complication. And that complication is called compartment syndrome. Remember all that fluid we talked about leaking into the tissues? Well, it causes incredible swelling. Now, in Amira's case, her arm was burned all the way around. That burned skin becomes tough and leathery. It's called eschar, and it has zero stretch. So it acts just like a tourniquet. As the swelling builds up inside, the pressure gets so high that it literally cuts off the blood supply to the limb. This isn't a wait-and-see situation. It is a surgical emergency right now. This is why those hourly checks are absolutely crucial. The medical team is constantly on the lookout for what they call the 6 Ps. They're asking, is there unrelenting pain? Is the skin getting paler, pale and white? Is the patient feeling paresthesia, that pins needle sensation? Is there pulselessness? Can we even find a pulse? Is there paralysis? Can they move their fingers? And is the limb perishingly cold? Spotting these signs early is literally the only thing that can save that limb. Okay, so we've talked a lot about the body, about physiology and medicine, but here's the thing. Is that enough? Is just treating the physical body the whole story? Amira's case shows us that real, true healing goes so much deeper than that. It's about treating the whole person. And this is where things get really interesting. we have to look at the human factor. You see, a patient isn't just a list of symptoms on a chart. They're part of a family, a culture, a whole community. And sometimes understanding their world is every bit as critical as understanding their biology.
See, Amira is Tongan, and in Tongan culture, the concept of Aiga, the extended family, is absolutely central to everything. Health decisions, they aren't made by one person alone. They're made by the whole family together. So a typical Western medical approach where you just talk to the patient, that's just not going to fly. It would probably fail completely.
So the key here, the really crucial point, is what we call culturally safe care. It's about building a partnership. It means bringing the IGA into every single big decision. It means using a professional interpreter, not just guessing. It means showing genuine respect for their cultural practices, like fofo, a traditional healing massage, and prayer. The goal is never to say our way is better. It's to say, how can our modern medicine work with your traditions to help Amira heal? And all of this brings us back to the final incredible challenge facing the medical team. Because through this entire crisis, they are performing a delicate balancing act. They're walking on a razor's edge, trying to manage a body that could tip over into complete failure at any second. And this right here perfectly captures the central dilemma of burn care. It's a fluid resuscitation tightrope. On the one hand, if you give too little fluid, their blood volume tanks, their heart rate skyrockets, and their kidneys will fail. Game over. But on the other hand, if you give too much fluid, you can literally fill their lungs with it, make the swelling everywhere even worse, and push them right into that compartment syndrome we were just talking about. It is an unbelievably fine line to walk. So how do they know they're getting it right? How do they stay on that tightrope? Well, it comes down to this: urine output. It sounds simple, but it's like a direct window, a fuel gauge for the internal organs. It tells them exactly how well the kidneys are getting blood flow. Hitting that super precise target, at least 1 milliliter per kilogram of body weight every single hour. That's the signal. That's what tells the team, okay, we're doing it. We're winning this fight. And in the end, Amira's story really makes us step back and ask a much bigger question, doesn't it? How do we balance this cutting-edge science with these ancient, deeply held traditions to heal not just a wound, but a whole person? Her journey shows us that the most profound healing isn't just about numbers on a chart or fixing damaged skin. It's about understanding that the human body is this complex, interconnected system, and that it's inseparable from the equally complex system of spirit, family, and culture. It really is a balance of science and soul.